Good evening, everyone, and welcome to the DA UK members event on portfolio careers. My name is Matthew. I'm the sustainability lead for Doctors Association UK, and I'm delighted this evening to be joined by Dr. Patrice Baptiste. She is a locum GP who has built her own portfolio career, and she's going to tell us a little bit this evening about what that means and why it should be something that we consider ourselves rather than just going through a standard sort of training program. So over to you, Dr. Batiste.
Okay, hi. Thanks, Matt. Hi, everyone. Thanks for the introduction. And I'm not sure if Ellen's here, because I can't see anyone or anything, but I wanted to say a special thanks to Ellen for asking me to deliver the talk. So I'll be talking about portfolio careers. Before I do start the talk, it would be great. I love connecting with people. So feel free to connect with me on any of the social media channels listed below. And feel free to check my website out as well, where I have a bit more information about myself and what I do.
One more thing, I'll just jump in and say,
Sure.
If anyone has any questions at any point, if you pop them in the chat, we'll keep an eye out for them and we'll answer them all at the end following the presentation, okay?
All right, thanks, Matt. Okay, so before I start, I thought it would be good just to talk a bit about myself and my portfolio career, and then we can talk a bit more about the importance and its relation to medicine. So my portfolio career really started when I was at a crossroads, when I was not sure if medicine was for me, after being 100% sure when I was 4 years old and gearing up everything I did to become a doctor. So after completing the foundation program, I took a year out like most trainees do now, or most early career doctors do. And I took that time to really just decide, like I said, if medicine was for me and if I made that right decision. Long story short, I realized that actually I still wanted to be a doctor. It was a lot of things that I saw once I started working, a lot of things around the system. And it was the system that I didn't really enjoy working in. And for me, it was, I know I still want to be a doctor, but then how can I return to a training program and how can I navigate this system to ensure that I can still work as a doctor and become the doctor that I had always envisioned? So I chose general practice, and I made a promise to myself that no matter what happened, I was always going to make sure that I continued my passions and interests and continued to develop other aspects in my life, which I hadn't done when I was a medical student and when I started working as a foundation doctor. So that's really how my portfolio career started, with a simple promise to myself to continue to nurture my interests and my passions. So currently, my portfolio career, I will talk about what a portfolio career is, but I'll divide up what I do into different sections. So first and foremost, I'm a GP, as you know, and that's the foundation to my portfolio career. And without being a GP or without being a doctor, I couldn't necessarily do all the other things that I do. So it all ties in quite neatly into medicine. So currently I work as a locum GP. I work across a number of different surgeries. I work remotely and I work face-to-face. I've done more remote work in the last year or so, a couple of years, but I'm doing a bit more face-to-face now. So I class myself as an educator. I love to teach. I love to support students, and I've done teaching in a variety of different roles, and I've also done some examining. Currently, I work part-time as one of the program leads and senior clinical lecturers on a master's program at the College of Medicine and Dentistry, which is part of Ulster University. When I was a salaried GP, I worked as a GP tutor, so I did that for 2 years. Even when I left the practice, they asked me to carry on, and this academic year I had to say no, partly because I've taken on other roles like being a lead at the college, but also because I wanted to develop myself as an educator at a high level, and I felt I was getting a little bit bored in that role as well. So I would have, and I'm not at the surgery anymore, so it didn't really make sense for me to carry on teaching the students if I wasn't having a clinic at the surgery. So I've also examined students as part of their OSCE exams. I haven't done much of that recently, but it's something that is always open to me. So during summer, I could always decide to do some examining. And then just before the pandemic, I was registered as a PLAB examiner. And in the last, about 6 months ago, maybe a little bit longer, I relinquished that role because, again, things change. Things are always changing. Life is always changing. And I just didn't feel it was practical for me to carry on in that role. But that's something I've also done in the past. And I've put upskill here at the bottom. Oh, and YouTube. How could I forget YouTube? I provide really informative content to support medical students really on their career journey, but not only medical students. Actually, in the last few years, it's been GPs, it's been GP trainees, and as a GP, a lot of my content is about general practice. So yeah, that's another way I educate. And so for me, upskilling is really important, and whether that's getting another qualification or actually getting practical experience. So I don't have a master's in medical education, but I was offered a job as a lead and senior clinical lecturer. So that has really helped me in terms of understanding education at a high level. So that's just one thing to bear in mind when you're thinking about maybe developing more skills. I love to write, and like I was saying, during my year out of training, I wanted to get back into writing poetry. I find poetry, or writing in general, really therapeutic. And I had stopped writing poetry for several years. So I started writing poetry again. And I started just submitting articles left, right, and center, basically, anywhere that would kind of consider me. My first article that was accepted was to the BMA News, I think it was at the time. It was like the little kind of supplement to the main BMJ a magazine, and that gave me the confidence to keep writing. And then I was speaking to editors, and they were just saying that keep writing, which I did. And I was looking for like a regular kind of gig, so to speak. And the editors were just saying, just keep writing. And I remember I submitted an article to GP Online one day, and I just said, I'd like to submit this, and I think I did a draft. And the editor, who's still the same editor today, and I'm still working at GP Online, she really liked it, and I just kept writing articles, and they just invited me to keep writing. So I've kept doing that. And I'm currently writing a book, which I'll talk briefly about, which is all about portfolio careers. Again, I was approached by Sign Publishing after we worked on a giveaway on Instagram to write a book about portfolio careers. They said that they were looking for someone to write that book, and they looked at my LinkedIn profile and saw that I had done loads of different things and felt that I would be a perfect fit. So we did a bit of kind of work together and some research, and then we decided to kind of go ahead with that. So hopefully that'll be out next year. Writing a book is it's a task and a half. I'm really enjoying it, but it does require a lot of research, a lot of time. But I think once it's out, it will definitely help a lot of people. So I've grayed out editor because I don't have a formal role as an editor, but I like to speak things into the universe. And one day I'm sure I will be an editor. Of course, I've edited things here and there, but I don't actually have a formal role. But that's something to aim for, isn't it? Other things that I do, so again, in line with medical education, I've started Medical Extra, which is basically a one-stop shop for primarily non-clinical careers advice for medical students and early career doctors. We host webinars and live events. One of our live events is actually happening today. And prior to that, I started an organisation called Dream Smart Tutors, aimed at aspiring medics and towards the latter years, medical students and doctors. And yes, I'm a speaker. I like to speak. You'll find probably as you go, I talk through the presentation, that often I like to seek out opportunities. So I've asked to speak at events, or I've been invited to speak at events, and it's just something that I like to do. And at the bottom here, champion for diversity. So again, a lot of the things that I do, whether that's through education, I like to kind of be a voice for those who might need one, and especially as we know about the disparities that exist in medicine. So that's something that I'm quite passionate about and that I've worked towards over the years. So now we can talk about, I suppose, what is a portfolio career. I'm sure you probably have an idea from listening to me. But basically, portfolio careers are essentially having multiple jobs, multiple interests, and it could be unpaid and it can be paid work. And one of the important themes, or one of the important things to point out, is that when you have a portfolio career, you have much more control, much more career autonomy as to how you can have your working week, or how you can really just carve out your own career path. And so, as it says here, you no longer have one job or one employer, but you have multiple jobs and employers. And it can be within one field, or it can be in multiple fields. And I often find that in medicine, because it's easier, it's easier to kind of have one stick to medicine and have that as one core foundation, rather than, I suppose, being a GP or being a doctor and then, I don't know, being a personal trainer or I don't know, a yoga teacher. I've gone to fitness, I don't know why, but just to try and give you like an idea. So yeah, so like I was saying, I think one of the key things here is that having a portfolio career, you have that career autonomy, you have that flexibility and that creative control to do, exactly what you want and how and when you want. And in terms of examples, we've touched on them already. So you can have a primary career like general practice, and then you can have satellite careers or satellite interests, so freelancing. So with my work for GP Online, that's as a freelancer. And if I've been an examiner, for instance, that's as freelancing. So I am employed and I'm also self-employed. Seasonal. So like I was saying with the examining, again, that happens through different points throughout the year. And so that's another way that you could carve out your portfolio career. And again, finally, part-timing. So you can just have a combination of part-time employed roles, which I have done in the past as well. So now we're going to talk about why they're important, which is the real crux of the talk today. So I think the important thing to point out is that portfolio careers have been around for a long time, and they've always been important in medicine for a number of reasons. But the one thing I want to talk about is really about the pressures of a medical career, especially more in recent years. So, I'm sure we've all been in the hospital. We've all, some of us, I don't know what my audience is today, but I'm sure there's a combination of people in training programs and people who maybe completed their training, and we've all been through it. We know how the pressures of a medical degree, and we know the pressures of actually once you start working, and then when you go further down to specializing. And so we know that there are many doctors and medical students who suffer with mental health issues and often don't feel comfortable in talking about those mental health issues because of stigma, because of how they feel that might affect their career. Again, if you have a lot of pressures on you, you might feel that you're not fulfilled, you're not meeting maybe your purpose, you're not satisfied. And we also know that burnout is rife, and that often when you're in a medical career, that you do have current episodes of burnout and potentially leaving medicine. So portfolio careers, in some cases, I know definitely in my case, it definitely helps to redress that balance and help you to feel a bit more satisfied, not just as a doctor, but in your other areas. So writing, I can nurture that, and that gives me deep satisfaction. And again, you can develop more skills, and you can develop those skills simultaneously. New challenges, it opens up new doors, and hopefully it reduces the risk of burnout and feeling really unhappy, which hopefully will lead to doctors taking or not needing to take sick leave, or leaving the profession entirely. And so once you have this portfolio career, you become more skilled, which then can feed back into your work as a doctor. So why are they important now at this current time? Well, we know what's happening at the moment. We know in medicine that pressures are only increasing, which does lead to retention issues. And I do really believe that portfolio careers will help or should help with retaining our doctors. It's definitely helped me. Like I said, I considered leaving medicine. And if I'm not able to do other things that I enjoy, I will find it very difficult to work as a doctor. Even, for instance, if I was just to be a writer or completely focus on one thing, for me as a person and my personality, that just wouldn't work for me. So for me, I feel that actually medicine is just one aspect to something that I enjoy, one aspect to me and who I am and how I identify myself. It's really important that we kind of maybe think of it in that way. So as we know, if we talk about GPs, we know that there are less GPs working full time, and we know that GPs, some of the data from NHS Digital know that some GPs have said that actually towards the end of the pandemic, or when it's eventually over, that they want to actually leave. And we know that more GPs are planning to retire early, and so on and so forth. So again, highlighted here, we know that there are more workforce pressures. Do doctors really feel valued? Do we know what's happening with pay restoration? Do we feel we're able to give, the best to our patients? And sometimes we might feel isolated, and we might feel there's a lot of stigma around what we're doing, or like I said, even with mental health. So I think that it does seem to be in a way that things are getting a little bit worse, and maybe that might be a point where you can reevaluate where you're at and maybe consider a portfolio career, especially if you know that you still want to stay in medicine. And obviously COVID has changed our outlook. It's changed the way we do things, everything. It's changed practically everything. And again, feeding into that above point, technology is accelerated a lot of things. Prior to the pandemic, for instance, in general practice, I heard a lot of negative comments about Babylon, for instance, and people felt very uncomfortable about doing video consultations and even telephone consultations. It was predominantly face to face. And so I think technology also has a part to play. And again, globally, we know again what's happening now: financial crisis, political instability. We've had how many prime ministers in the last how many weeks? So I think there are so many things that are ongoing. Why wouldn't you consider thinking outside of the box, or thinking about other aspects to just enhance your career? So just a few questions here really to think about, with all these things going on, how can we adapt? We should want to adapt. And how can we maintain a competitive advantage in an ever-changing world? How can we change the way we think? And how can we use technology to advance or even change our careers? And no one really likes to talk about money, but of course we're talking about money more and more, especially with, like I said, with the pay restoration. How can we generate different streams of income so that we can maybe just stay afloat or stay stable, financially stable? So, like I've spoken about several times in this talk, career autonomy is a really big one for me. I'm so happy that I'm able to have that, control over what I do, when I work, how I work, and where I work. And I think for me, and for many doctors who do have portfolio careers, that this does lead to better mental health and better work-life balance, and opportunities, and definitely being able to nurture other aspects to my life and my, the different careers. I think it makes me a better doctor, and it's helping me stay in a very difficult environment, so to speak. So again, more opportunities and competition. By gaining new skills, you stay competitive. You can apply for jobs that maybe you felt you couldn't have applied for before. It enables you to take risks and try new things where potentially you wouldn't be able to if you're just dependent on maybe one career or one area. And if doctors do want to leave the profession, there's nothing wrong with changing careers. I feel that we do stigmatize doctors who want to leave medicine. If people feel, what, I've just had my run, I just want to do something different, or actually I just don't enjoy working anymore, and I don't think that's fair to myself or my patients, and I think that they should then leave. And having a portfolio career might enable you to make more of a gradual transition, rather than just saying one day I'm not going to do this, and then all the issues that might come with that. So again, in some cases, yes, you might be able to have better financial security and financial gains. And like I was saying, you don't actually have to depend on one job or source of income. So at this point, I'm going to talk a little bit about career development, which hopefully, if anyone listening, watching the talk, wants to think about how they can start a portfolio career, or just start nurturing maybe one or two aspects to interest that they, things that they enjoy. Just a few things just to get you thinking, and just to pose some questions, really. So let's talk about career development, because actually during medical school, we don't actually have that much career guidance and career support. Maybe things are changing now, but for me, again, there wasn't that support. And I think it's really important that we do have that. So the Cambridge Dictionary defines career development as the process of learning and improving your skills so that you can do your job better and then progress to better jobs. That's a great definition. I do think it's a little bit simplistic, and therefore from my research and from my personal experience, I think that career development is an ongoing process of understanding yourself better, the whole world around you, and using all of that information to inform your choices and therefore your career path. which can include a collection of your jobs or your vocation. I've put the GP portfolio career guide because I talk a bit about, well, talk a lot about career development in the book that hopefully will be coming out next year. So like I said, it's not really taught at medical school, but I do think it can help with a lot of the issues outlined above, especially mental health issues. It's important to really understand the theory behind developing your career, whether it's a portfolio career or whether it isn't, and especially if you are confused or struggling on your journey. So I'm going to talk about, talk about some key points from some of the career development theories. I'll talk about really briefly about traditional career theories. They are a bit outdated, but I do think that we can still draw really useful information from these theories. So the theories that I'll talk about briefly do have a heavy focus on understanding you and the job market to some degree. So firstly, do you know who you are? Do you know, if someone asks you, what would you say? What are your skills, your qualities? What do you actually enjoy doing? What gives you pleasure? And what are your achievements? And do you have a record of that? And do you understand the world around you, the job market? Do you understand how competitive it might be in certain areas? And do you know what opportunities are out there that you might potentially want to get into? So there are obviously a few different career development theories. There's Frank Parsons, who talks about the matching theory, and he talks about choosing a vocation versus a job, which obviously, as we know what a vocation is, try and look for something that gives you a deeper meaning in the work that you do, which does mean potentially that when you have these pressures, you're more likely to maybe be able to ride it out and be able to adapt and be more resilient. And I think that's definitely the case for me. I chose medicine because for me, it was attached to a greater purpose. So when I was at that crossroads, I did go back to my original kind of purpose, which is being a doctor, wanted to help people. And that's enabled me to carry on. And understand, he talks about understanding the job market and trying to make a match between the jobs and the job market out there and you. Someone called Ginsberg, he talks about it takes time to develop a career that you're happy with. It doesn't happen overnight, and it may well have to be a compromise between your values, your beliefs, and what's out there, what opportunities that are open to you. And it might be difficult to reverse this process. Like we know, some of the reasons why many doctors might struggle to leave medicine if they're not completely happy is because they've spent a lot of time and effort and money. They've invested so much. And for them, it might feel very difficult and maybe in some cases impossible to actually try to reverse this. But I've put in brackets here, it's not impossible. And I find sometimes that in medicine, we do become a bit institutionalized, and we think, we can't necessarily leave now. But we have so many skills and so many transferable skills that if we did want to leave, not that I want anyone to go, but that's definitely possible. And not just medicine, it's in any job, in any career. So that's what Ginsberg talks about. And again, a few points from Super's theory. So he talks about, you're different. So it's really important not to compare yourself to others. Your journey is unique, and that it will change because life is always changing. We're always changing. And you have the potential to be successful in multiple careers. So try not to limit yourself and look for patterns in yourself, so qualities and strengths, and in jobs that will make you best suited to those opportunities. And so key points would be finding role models and mentors that you can identify with, which definitely helps, I think, with career progression. So again, Super, he again speaks about other things as he develops himself and his research. And he talks about, as career development is ongoing, where it's a lifelong process and we'll go through various different stages, from the growth stage to exploring different things and maintaining and establishing our careers, and decline as we then reach retirement. And again, towards the end, it's about 1980, Super talks about that you will play different roles in your life at different times, so whether that's as a mom or a student, and that also success in one role does often help develop success in another role, which I think is a really important point as well if you're looking to maybe transition into other areas. Again, he talks about testing your concept against reality. Can you test it? And can you make your concept your reality? So if you had an idea about an area that you wanted to get into, could you test that somehow? And if you can, again, evaluate the results of that, and how likely is it that you'll be able to turn that into your reality? And will this benefit you and the world around you? And again, just a brief note about Roberts. He's someone else who talks about opportunities. So again, are there what opportunities are actually available to you? And just maybe being a bit realistic. So again, so those theories, they're more what we call, I suppose, traditional theories. And then there's a newer kind of theory or way of systemic thinking, or the systems theory framework, which does talk about being holistic. So as doctors, we always have to think about, especially as GPs, we think about the patient as a whole. And so for your career, you should also think about it as the bigger picture. So when you're designing or redesigning your career, think about the things, the wider elements that impact your career. And systemic thinking does place emphasis on your career is affected by time and serendipity, which actually was talked a lot about when I was on a leadership course at UCL. A lot of the amazing leaders I listened to talked about luck and that steering their career. So again, some of the traditional theories, they didn't really focus on certain groups. So it was mainly males. So there was a bit of lack of diversity there, and they didn't really focus on the labor market changes. And they're psychologists, and so they focused on more qualitative data. So yeah, so that's all I want to talk about in terms of the theories. I think it's really just about stimulating your thought processes, getting you to ask questions. I mean, you don't have to agree with it, but it's really, like I said, just to stimulate your thoughts. So just if you wanted to start your own portfolio career, or just just think about writing some things down. Here's some practical points that you might find beneficial. So one is formulating a plan to create your career, and you might then want to assess, like I've spoken about, yourself and really understanding yourself. And I think sometimes we might get lost because of what we're doing, whether that's in our professional or personal lives. Think about the wider environment. Like I've spoken about, there's so much going on in the world, and how does that impact you and your career? And what do you think is possible now? What do you think you can achieve now? And what would you like to achieve in the future? And so if you've identified maybe one or two areas that you think is possible and that you're interested in, how could you possibly get started? So for me, when I went back into full-time training, I spent a lot of my evenings and weekends working on projects. So that might be one way, again, to make more of a gradual transition. Or you might want to actually adjust your hours or your schedule to make room. So you might want to then, if you're a trainee, think about part-time work, less than full-time training. There are out-of-program experiences that, again, may not be well known about. So it might be worth speaking to your supervisor if that's something that you wanted to pursue. You might need approval in some cases, or you can just jump and you can just leave completely. I don't know how appropriate that is for many of us. So again, just talking a bit more about what you need to think about in terms of if you're serious about creating a portfolio career, just some positives and negatives, and these are just a few. There are obviously more, but like I said, you have that creative control, you have that autonomy. However, some people might then think, actually, I've got loads of commitments, I feel overwhelmed, and that might even lead to burnout. But on the other hand, people do find when they have a portfolio career that they actually have a better work-life balance. You can, like I said many times in this presentation, you can develop so many new skills all at the same time. And I think it's good for someone, who likes variety and who likes to try new things. Is not afraid of kind of failing. And there are financial capabilities, but of course it depends on what you do and what you're interested in. And some people, like I was saying, they might struggle with that transition. They might struggle with, if they're not working 1 or 2 days out of the week, how do they kind of get that structure? And in some cases, you might actually suffer a loss or lose that financial security in some ways. So again, just a few more questions, because I like to ask questions and get you thinking. So just some more questions to kind of just stimulate your thoughts would be, what do you want out of life, and where do you see yourself in the future? It's obviously impossible to predict the future, but it might be worth just thinking about where you see yourself, whether that's 2 years, 3 years, 4 years, 5 years, and what type of career do you want, and how can you start creating that now? It doesn't have to be big steps. It could be small small things. Like we've seen, it's a lifelong, ongoing process. And then who or what do you need, or what do you need to do to make it happen? I think having a mentor or having support systems is really important. And often we've heard about that saying, which is, your network is your net worth, which is really, I think, really true. And again, think about if you want to make a gradual sudden transition. And I think probably for most people, you'd probably want to do more of a gradual transition, even if, like I said, you wanted to leave medicine. Of course, if you feel that you want to leave now, then and that is something that you want to do, then that obviously suits your circumstance. So just to end the presentation, I'm conscious that I've spoken for a while now. Just a few things that I've learned from my journey, and my journey, it's again ongoing. But for me, number one is knowing who you are and following your mind. There will often be many people, whether that's in your personal life or colleagues, professional life, who tell you maybe this isn't right for you, or don't agree with what you're doing. But ultimately, it's your life, and you have to live with the choices that you make. So I think it's really important that you know who you are and you follow your mind and you stay committed. And if you decide that actually this isn't right for me, then you can change your mind. Number two is taking risks. I think it's important to take reasonable risks. I'm not a great risk taker, but I think you have to step outside your comfort zone and do things that maybe you necessarily wouldn't have, to make things happen and to go in a direction that you want to go in and be happy with. Test the water. I think, again, having a portfolio career enables you to dip your toe in the water and try things and try them gradually. And number four is knowing your worth and knowing that you are capable of so much. And I often find that we talk about imposter syndrome, and it's very real. And I wouldn't say I have imposter syndrome, but definitely there are times when I lack confidence in myself, and I have to remind myself of all my achievements and all my accomplishments, and that kind of keeps me going. And obviously feedback from other people, it does help. But I think it's really important that you know that you're valuable, know your worth. And finally, but not finally, your future is limitless, and you have that control to carve out a future that that you are happy with. And then again, like I said, finally, upskilling is really important. You don't always have to gain an extra qualification. In many cases, you might need to, or it will help. But having practical experience is often very valuable. In some cases, more valuable than a qualification. And network, like I said, is really important to build a connection, build connections with other people. And I would always encourage medics to build connections outside of medicine, because there's so much to gain from hearing other perspectives, whether that's from a lawyer or a journalist or engineer. So I think that's the end of the talk now. I've just put the last slide, the proposed name of the book. And if you're interested, I have quite a few GPs now, but if there are any GPs who are watching, and if you wanted to talk about your career, then please do get in touch. And Medical Extra, we are looking for, as always, doctors and students to help with push our vision and to support current and future medics. So I'll leave it there, and I think we'll open the floor to questions. I think Matt might come back and
yeah, I'm here, don't worry.
Do you have any questions? You haven't run away, have you?
No. Gosh, I'm about to finish my foundation year 2. Well, not about to. Next year in August, I'm about to finish foundation year 2. Couldn't come soon enough. It's certainly a lot to think about with regards to an alternative way of building a career, and like you say, we don't get taught that in medical school very much. You pick up bits and pieces, but by and large, it's more about going through a training program. You might have an F3 year, and then you're a consultant, and that's it until you burn out, or you're in a specialty that you enjoy. But the idea of incorporating your interest into the career, it makes sense, doesn't it? Really, it's about building your building medicine into your life rather than making your life built around medicine.
Exactly, and one of my main aims is to help and support doctors to have long and prosperous careers. And okay, there's one argument, well, actually, you're working part-time and the effect that that has on the workforce, but actually, would you prefer us to leave then? You know what I mean? I think, you have to kind of compromise somewhere. And if I'm able to stay, as a GP until, I don't know, I'm 60, surely that would, that would help. So I think, yeah, it's about looking and changing the perspective on things as well sometimes. Because I do personally think, and I've had people say things where, portfolio careers are very stigmatized. How can you be a doctor if you're only working part-time? How can you really, how do you even enjoy, being working as a doctor? But I do enjoy working as a doctor, because I would probably, I would leave. But I think, like I said, in my year out, I realized that I really still want to be a doctor, and I have so much more good and so much more to offer to the medical world, and to the patients that I see, and the patients that I will see.
Yeah. So if has anyone got any questions? If so, please pop them in the chat. I know someone has asked if the slides are going to be shared later on, and actually we're recording the session, and that will be made available to members after this is after it's finished. If anyone has any questions, please pop them in the chat. But one from me, I think. You mentioned a little bit about sort of some of the barriers, in that it's quite an unconventional route, isn't it? It's not a path well trodden, if you like, particularly with other specialties as well. Can you tell us a little bit about some of the barriers that you faced, the challenges you faced, and how you've overcome those?
I mean, what I would say, which I do talk a bit more about in my book, portfolio careers have been around for a long time. And I think we often associate portfolio careers, or we hear the term portfolio GPs, because it seems like it is a bit easier to have that portfolio career as a GP. But actually, doing research in my book, there are many physicians from centuries ago who were doctors. I mean, obviously things have changed now, so I don't know, was it easier back then to do that? But actually, there are many physicians who, and even now, I've come across some really well-known doctors who are not GPs, who are physicians, who are hospital doctors, and they have portfolio careers. So I think it's very doable. I think it just is how you do it. I've forgotten the doctor's name, but I went to a talk when I was on my year out, and she said that I think she was like she was a staff grade or something, and she wanted to be a surgeon and pursue that pathway and be a consultant, but she also wanted to be an author. And so for her, she felt actually it was some kind of compromise where she didn't want to keep being in training, and she just wanted to, but she still wanted to be a doctor, and she wanted to then be able to develop her other interests. So I think for me personally, I haven't had like really big challenges in a way. I think for me, a lot of the time, it's just about making sure that I'm conscious about the decisions that I'm making, that I'm not burning out, and that I'm not spreading myself too thinly, which is why, as you heard in the beginning of the talk, I've cut back on a few things, because it's just not possible. And then you have to think about, where do you want to go? So being a GP tutor is great, and I've learned so much from it, but I want to become, you know, I want to develop as a medical educator, and for me, being able to take in that opportunity at the college will enables me to do that. So, like I said, I haven't really had what I would say kind of big challenges, or big kind of issues that I've had to overcome. I think it's been quite a straightforward path, because I've made that promise to myself, and I've been intentional as to how I've gone about things. And often I find that even when I was a child, I kind of just did my own thing, and I'm very strong-minded like that. So, yeah, I mean, it hasn't made me popular, but if I decide I want to do something, and it makes me happy, then and it's reasonable, I go ahead and I do it. So I try not to listen to other people so much, because, like I said, you have to live with your decisions, and I have to go do, be happy with what I'm doing, and I just, I have to listen to my inner voice. So I hope that answers your question in some way.
I think you mentioned I forgot what I was going to say.
That's all right. It happens to me all the time. I'm surprised it didn't happen during the presentation, actually.
Oh gosh. So have you heard of other specialties where this? You mentioned orthopedics, and I've heard sort of things like the Caesar training pathway with regards to emergency medicine, where you sort of build your own portfolio and then qualify as a consultant. Are there other sort of availabilities or possibilities like that for other trainees within sort of general medical or general surgical specialties as well?
That's a very good question, and I actually don't know. That's the short answer. I think, of a lot of these things, like I was saying with the out of program experiences, it's about asking people and looking around and searching for things, because, like I was saying, it's not often spoken about. You might even speak to your supervisor, or if there's people in the hospital who you might think know or might know someone who will know, or even contacting the deanery. I think it's just asking about these things because sometimes they're just not known about. So that's how I would kind of what I would say to that. Um, but yeah, I think I was going to say something as well, and I forgot. I think I've been talking for too long, but I think.
So,
what's that? Sorry.
I was saying I've remembered my other question now. So.
Oh, great timing! Saved by the question.
Yes. So I know you talked about having to roll it back in a little bit from spreading yourself too thinly. I imagine with a portfolio career, it's very easy to overcommit yourself and say yes to a lot of things. How do you balance that, and how do you choose which the right things are to say yes to? And are there any difficulties once you've committed in backing out of those things?
All the time. No. I think for me, I have a very clear idea of what I want to do, and so as you can see, I've divided them into like the different things I do. So I don't really have that many things. It sounds more on paper, but it actually isn't that much. So a lot of the things I do is related to medical education, so I find that helps me in a way. And like with teaching, so if I was at the college and I'm designing an assessment or something or writing questions, it helps me with my work as a GP because it's refreshing my knowledge. So I find a lot of the things I do, they all tie into the core, which is medicine and being a GP. And I find that really helps. It is easy to overcommit a lot of the times. I find if you're passionate about something, you can push yourself a bit more. So I find that, yes, I do things that I'm really interested and passionate about. Otherwise, I just wouldn't be able to do them. But yeah, I think because if you work 2 or 3 days after the week as a GP and you have the remainder of the week, you might think, oh yeah, I can do this and this, and it doesn't maybe always work that way. So you might, like you said, overcommit, oversubscribe, and realize actually when it comes to it, maybe I shouldn't be doing that. Maybe I should be resting. So it's definitely happened to me. But like I said, I think I have a very clear idea as to where I'm going, and so it makes it easier for me to then decide on what things I want to do, and to pull back on and to invest more time in.
Is there anything that you think you'd do differently with building this portfolio career? Are there any sort of steps, particularly in the early stages of directions that you might have gone slightly differently, or more so that people can learn from your mistakes, if you like, in a successful way?
I think looking back, I mean, it's a very difficult question to answer in a short space of time. I wanted to take a second year out of training, actually. I wanted to take an FY4 because I literally, at the end of my FY3, I started doing smart tutors and it was just getting going. And I remember thinking, gosh, if I go into full-time training, and I didn't want to go into part-time training, but maybe I could have, that's maybe another thing. But I remember thinking, if I go into full-time training, how am I going to juggle all of this? I'm just getting some traction. I was working with companies and I was doing talks and I just thought, is it a good idea to, go back, and how will I juggle everything? So potentially I could have taken another year out, which might have helped me gain a bit more traction more quickly, or maybe more success with doing smart tutors in a way, or even going less than full time potentially. So those might be two things, maybe taking a bit more time out, try not to rush, and just weighing up all your options. And I think, again, when you're in training, it's difficult because, you are immersed in medicine and everyone you're around is really a medic in a way at work, isn't it? So, and unless you make a really conscious decision to, I don't know, marry a non-medic, or I don't have non-medic friends, you can just be in this bubble. And I did, in my year out, make a really conscious effort, and I worked really hard to network outside of medicine. But once I got back into training, I kind of didn't do as much of that. So I would encourage people, especially, medics, like I said, we get lost in this bubble, which is great because we do need to be immersed in medicine because it's the nature of what it is. But I think that we should kind of step out of this bubble and build and forge connections with others who are not medics.
It's really interesting because you do get so fixated, and I think that's where part of the burnout comes, because you end up living and breathing your job, don't you? If you're in full-time work and you're doing nights and then you're socializing with medics as well, it's who are all lovely people, but there's that element of too much medicine, if you like.
Yeah, I think so at times.
Yeah. So have you got any other sort of, I think we're coming up to close to an hour now. Have you got any key messages that you want people to take away from this talk today?
I think the key message is to really understand yourself and think about what exactly do you want to get out of life? What do you want to get out of your career? And being true to yourself. Yeah, I think those are my key things, really. Just knowing yourself, drowning out other voices when, they may not necessarily agree with you and it seems like they're trying to derail you, so to speak. Obviously, listen to sound advice, but try to differentiate between, what's your inner voice and what you feel you're being called to do or what you feel is best for you versus to listen to other people who may not be in your situation and don't know exactly what you're going through and what decision might be best for you. So knowing yourself, being true to yourself, and networking, like I said, with medics and non-medics, and just create something that's unique to you. I think a lot of the time we get caught up by looking at what other people are doing, and I think that can be quite toxic. So just focus on yourself and draw inspiration from other people, but don't necessarily copy or imitate them. And I'll leave it there because then I'll just start rambling.
And it really comes back to autonomy, doesn't it? Like knowing that you're in control and that you're in control of your sort of destiny, if you like, I guess.
Yeah.
Dr. Patrice Baptiste, thank you so much for joining us this evening. For those attending and those watching, catching up later, please follow Dr. Patrice on her social media accounts, which she shared at the start of this webinar. And thank you very much, everyone. Have a good evening, and we'll see you at the next, I think.